Thanks for joining tonight. Hopefully you're here for the No Overdose series. My name is Sherry Egeland, and I am the Associate Director at Omni Youth Programs. Looks like the video stalled for a minute. Let's see. I think the video is having a little trouble, so I'll wait just a sec. Okay. Hi, everybody. Thanks so much. I'm going to do the intro again just in case because the video stopped and started again. But thanks for joining. My name is Sherry Egeland. I am the Associate Director at Omni Youth Programs. We are a nonprofit in Sacramento, California, and our mission is to prevent the youth use of alcohol, marijuana, and other drugs like opioids, which is what we're going to be talking about tonight. Today is part one of a three-part series that we're doing called No Overdose. So just hoping to let people know what the signs are if somebody is overdosing, because sometimes it's hard to tell if somebody is just really high or drunk, or if they need help. And it would be great if everybody that's out there listening could know the signs for both opioids, and then part two is alcohol, and I'll give you the dates when we end today. And then part three, we're going to talk about marijuana overdose, and then what you can do in all those situations. So let's get to it. If you have any questions, feel free to put them in the comment. At the end, I'm going to leave you with some resources in the comment box over there. But let me start out, because not everybody knows what opioids are. It's been in the news a lot lately because there's been a lot of tragedy around it. It's a very serious subject. But just in case, just to let everybody know, opioids are actually the simplest way, because I'm not a medical doctor by any means, but opioids are pain-relieving drugs. They basically bind to receptors on nerve cells, and they block pain signals. So the goal of them is to, of course, reduce pain. Now, morphine is probably the one that's been known the longest. That's natural, and it comes from the poppy plant. But drugs that you hear about sometimes, more like hydrocodone, oxycodone, codeine, and fentanyl, all of those are man-made. So what they're called is a synthetic. So that's kind of what that means, that it's not something that's derived naturally like morphine is from a plant. It's becoming really a national tragedy, and really a cause that has meant a lot to us at Omni and at Sacramento County as a whole. But at the beginning of this year, the CDC announced that deaths due to overdose have topped 1 million for the first time since they started recording this in 1999. That's a lot. My thoughts and prayers go out to anybody who is struggling with addiction, and to anybody who's lost someone. I saw a recent study from the CDC said that opioid users, depending on the study, 65 to 94% of them have witnessed an opioid overdose. So it is something that's happening out there and something to be aware of. And opioids are actually a factor in 7 out of every 10 drug overdose deaths. So that's a lot. That's a big difference. It's not all, heroin or things like that we kind of grew up thinking. This opioid thing is kind of new. Just another little factoid here, that young people aged 15 to 24 saw the biggest year-to-year increase of fatal overdose deaths. Their deaths were up 49% in 2020. Now, we're not sure if this is due to COVID, the isolation that was happening for young people, just a lot of free time too, just kind of bored, not knowing what to do. But a lot of people struggled with mental health issues, and sometimes turn to opioids for, self-medicating. So I do encourage anybody out there that is struggling with that to seek a mental health professional. You can email me privately. Again, I'll put my email in there at the end so everybody can have it. I'd be happy to email you any resources about anything that could help. You probably have also heard that in recent years, most overdose deaths have involved what's called illicit fentanyl. And remember, fentanyl, I know those are two kind of funny words there, but they're very serious. Illicit means that it was not gotten from a pharmacy or a medical facility, that it was basically just made by drug dealers. That's like kind of a kind word for them. They're made by people that are just trying to make money off of addiction, basically. And fentanyl, remember, is man-made as it is. So it's an extremely volatile drug to try to manufacture, especially without any medical background. And that's what's happening a lot. People think that because their drug looks like a prescription or the pill that they get from a friend, they're assuming, well, somebody got it from a pharmacy. But a lot of times that's not the case. And you have to be very careful because they have, the drug dealers, the people that manufacture this stuff, have something called a pill press that you can purchase. And it looks almost exactly like something a pharmacy or a reputable medical establishment would make. So even if you're looking at it, if you didn't specifically get it from your doctor or a medical professional, you personally, not that you think your friend did, but that you did, I would really recommend not doing it. It's really not safe, especially because you don't know if fentanyl is in it or how much is in it. I had a really good example explained it to me, and it helped me, so I thought it might help y'all too. But when you're thinking about fentanyl, thinking about it this way. If you ever made chocolate chip cookies, which yum, right? But you add the chocolate chips, and imagine there's a fatal dose of fentanyl in like 2 or 3 of the chips. The rest of them, you'll get high, but you'll be okay. But the rest is a fatal dose. Because really just a grain of salt level of fentanyl is enough to be too much to kill you. So you make the chocolate chip cookies, then you make a batch of cookies, right? And go to a party and hand out those cookies. Now some people are going to be just fine, right? Because they're not going to have those 2 or 3 chocolate chips in their mix. But you don't know what the fatal dose is, and we're all a little different biologically too. Medication affects everybody differently, and so even again, if you have a friend that seems to be using it safely, really now with fentanyl out there, again, unless you get the medication directly from your doctor, don't use it. It's really not worth it. One pill really can kill. But let's get back to why we're here about overdose. So how do you know if somebody is high on opioids? There are some keys to that to know, and then we're going to talk about when you need to be concerned about possibly an overdose. So how to recognize somebody being high is they're super duper relaxed, because it definitely is a muscle relaxer. It's an inhibitor, so they do seem, they're not energetic and running around like some other drugs. Their speech is often very slow and slurred, which some people might think that can be alcohol, but if you combine it with other things, they're very sleepy looking. Sometimes you'll see people who are high on opioids and they're standing up, and it looks like that, like they're almost sleeping, standing straight up. They might even be kind of slowly moving and trying to do things, but they almost look like sleepwalking a little bit. Head nodding, frequently, especially if they're sitting up or standing and talking to you and they can't seem to keep their head up. And they respond. If you go, hey, are you okay? What's going on? They, recognize that. Those are all signs of being high on opioids. Now, how to recognize an opioid overdose when you need to help that person needs help, is basically the skin can sometimes turn like a bluish color, not always. Now remember, these signs, they don't have to have every single one, but if you notice more than 1 or 2 of them especially, you might want to get them some help, and we'll talk about what you can do in a minute. But the skin is kind of blue. Usually the lips and the fingertips are what's going to turn blue first in an opioid overdose. Again, the body is very, very limp. Like they sometimes usually can't even stand. And even sitting up, sometimes it's hard. The face is really, really pale. All the color kind of goes out of their face. They're conscious, meaning that they're breathing and they might even be making little noises. But if you go, hey, are you okay? They can't respond. So they're conscious but not able to respond. They might be making sounds like they're choking, or like if you've ever heard somebody snore, when that gurgling sound when they're sleeping, that can happen. Their pulse is slow and very erratic, or it kind of comes and goes. It's not constant. Or you might not even, the pulse, you might feel for pulse and not feel anything. It might be so slow. Sometimes they'll vomit, and oftentimes they will lose consciousness. But don't wait for somebody to lose consciousness to help. Sometimes people think, well, as long as they're awake, they're okay. That's not always true. If any of those things are happening, especially, they don't respond, if you can't seem to get them to respond to anything, that's usually a big sign. So what do? Okay, I think this person might be having an overdose issue, an overdose on opioids. You kind of handle an opioid overdose very specifically. It's different. That's why we're having this series. You handle an opioid overdose differently than an alcohol overdose or a marijuana overdose. You handle them very differently. So with an opioid overdose, one thing that you can do is there's something called a sternal rub. Like you can take your knuckle, and if you feel comfortable, you don't ever want to do something that makes you feel like you're invading somebody's space or puts yourself in danger. But if you feel comfortable, take your knuckle and you rub what's called their sternum. Even just doing it a little bit on myself right now hurts really bad. But it hurts. But remember, it's not gonna cause any damage. But if you rub the knuckles hard and up and down on the breastbone, it really can help assess whether somebody is conscious or not. Because if they're not responding to that, they're really not conscious. It may make the person breathe, but they won't wake up and start talking to you. So you want to check for breathing, and you absolutely want to call 911 before you give any other aid. Call 911 immediately. Let them know what's going on. Please know that in California especially, and all over, many states have something called the Good Samaritan law. And even if you're underage or if there's technically illegal drugs on the premises, if you call, somebody has an overdose, if you call 911 and get them medical help and stay with the person until help arrives, then you're free from any kind of trouble with any kind of getting arrested or the law or anything like that. Now you have to stay with them. You can't leave. But if you call 911 and stay with them, the Good Samaritan law does protect you. So after you call 911, if you can do rescue breathing or CPR. I know growing up, CPR was kind of a newer thing for me, but I really encourage you. I'm not a CPR instructor, so I don't want to try to give you, but there's a lot of really good videos online, especially chest compressions or mouth breaths, but I know chest compressions is one that's really important. And let's not forget to administer naloxone. Wherever you are, whether it's a school or a business, don't assume that just because you don't have naloxone, somebody on the premises might have it. Just shout it out. Sometimes people, businesses are starting to have that on hand, which I think is wonderful. Schools are starting to have that, which I think is wonderful. We are part of a really good coalition called the Sacramento County Opioid Coalition, and I'm going to actually put their website here. It's, let's see, Sac County Opioid Coalition. And if you need, the reason I'm writing it down is because coalition. If you need some free access to naloxone or anything else like that, they can help you with that. Oh, thank you. I see somebody else put it. There we go. Just popped up right there. Perfect. So go and hit the Sac County Opioid Coalition, and they can help you know where to get naloxone for free. And please don't be afraid to use naloxone. Naloxone has no abuse potential at all. People cannot get high on naloxone. And some people are afraid, well, what if I give naloxone and the person hasn't been using opioids? Would I hurt them? No. Naloxone has no effect if opioids are not present. It won't hurt you. So even if you think somebody's been using opioids and, it was something else like meth or something, that's okay. You're not going to hurt them. It's a kind of a better to be safe than sorry. It has absolutely no side effects either. It is actually a very safe drug. If opioids are present, the overdose is reversed and then the person starts breathing again. However, sometimes you'll see those opioid withdrawal symptoms happening, and that's okay, because basically what you've done is kind of lessened and that's okay as long as they're alive. That's the good thing. But it works very quickly within 2 to 8 minutes. But it really depends on the person's metabolism. the type of opioid, because there are short-term and longer-term acting opioids out there. But it usually wears, the naloxone can sometimes wear off before the opioid or heroin does, so it's important to stay with the person. And you really can't give a person too much naloxone. So if you give them one hit and there's not an effect, within a couple of minutes, you can do it again. But it's usually administered, through like a nasal. There are shots. I've seen those before too. But it's basically, naloxone is an opioid antagonist, what they call it. It blocks heroin and other opioids from binding to the receptors in the brain. And it basically reverses the respiratory depression that's caused by an opioid. And that's most often when somebody dies from an opioid overdose, it's from that respiratory depression. So hopefully this information that I've given you is helpful and will help you help somebody. But I really encourage you to, go to Sac County Department of Health and Human Services. There's a lot of free treatment available out there if you are struggling with addiction and need some help. Or again, if you need a very specific resource, like if you want something for a younger person, or if somebody is a recently immigrated, or you need somebody that speaks a different language than English, please email me. I just put my email right there. I can send you all kinds of free resources for stuff like that. And especially for young people, if you check out, I'm going to put our Omni's website. We actually have a cool little handout on there that it's a little postcard that you can download. It's on our resources page. And it's, if you do go to the doctor or the dentist, what are some questions that you can ask the doctor if they want to give you opioids, for instance? Dentist is actually one of the most common places that young people are getting opioids. So there's some questions on there, things you can talk with the doctor, and how, if you do need to take opioids from a medical professional, how you can do that safely. Because it is very necessary. Some people really do need that to manage pain, but again, you have to be very, very careful. So hopefully I don't see any more questions. Thank you, Cynthia, for the nice comment. I appreciate that. And please, again, email me if there's any other information I can give you. And I'm going to repost this video to our page. So if you saw it and you think it's helpful, feel free to pass that on to your friends. Thanks for tuning in. We'll see you. Oh yeah, I forgot. The next time I'm going to be doing this, March 23rd. It's also a Wednesday. We're going to be talking about how do you tell if somebody is kind of just drunk and passed out, or they are overdosing and need help. And then on April 13th, we're going to talk about marijuana overdose, which is surprising. Some people don't think you can overdose on marijuana, but you absolutely can. It's called greening out. We're going to talk about that. So feel free to turn in parts 2 and 3, and I will see you then.